Myers Counseling Group podcast. We offer mental health, substance abuse, and wellness information for the community. To find out more information and to access previous podcasts and other resources, visit us at myerscounseling.com. Hello. Today I would like to welcome Jean Vargas. Jean is a therapist working out in the Gurnee area. Jean, why don't you tell us a little bit about yourself and the types of clients that you see?
Sure. I am a licensed clinical social worker. I got my master's degree in social work from Loyola in 1997. I've been in practice since then. I've got a history of practicing in outpatient community mental health, group private practice, and now my own private practice.
Excellent. Today's topic is going to be on eating disorders. And I understand that's one of the populations that you work with.
Yes.
My first question, Jean, would be, what would determine a diagnosis of eating disorder?
People who have eating disorders usually are either restricting calories, in part to lose weight, and then other people who have eating disorders are increasing their caloric intake, binging on foods, and some people also are binging and then purging the food.
I see. So if you could explain the differences between different types of eating disorders, anorexia, binge eating, bulimia, if you could explain a little bit about that.
Okay. Anorexia is people who are restricting their caloric intake in attempts to lose weight, to feel better about themselves. However, most people with anorexia don't get to the point where they feel good about themselves. They keep restricting their caloric intake. Binge eating are usually people who are increasing their caloric intake. They binge usually a lot of food at one particular time. It could be once a week, it could be once a day, it could be once a month. But binge eating a lot of food all at one time. And then bulimia that diagnosis are people who are binging on food and then purging that food. And sometimes that's purging in terms of vomiting that food. Sometimes it's purging in terms of using laxatives. In other words, binging on a lot of food and then trying to get rid of that food out of their system as quickly as possible.
Okay. So purging doesn't necessarily mean self-induced vomiting. There's other types of purging.
Correct. Yes. People who are binging on food and then purging, trying to get it out of their system as quickly as possible, sometimes using laxatives, that type of thing.
Who's usually affected by this?
Well, it can run across the population. I see it most of the time presented in my practice, girls, teenagers, who are wanting to look good for their friends, for boyfriends. They sometimes have body image and self-esteem issues. However, I have seen it in boys as well, and then I've also seen it in adult women, adult men.
Is there one population that you may see more often than others when talking about an eating disorder diagnosis?
Yes, most of the time I see it in teenage girls.
Is there a cause or reason why people may get eating disorders?
Most of the time, the cause that I see comes from environmental causes. Sometimes it's messages that have been handed down through their friends or their families. They're expected to look or act a certain way. Sometimes it's messages they receive from the media. Girls are expected to look this way, act this way in order to be accepted in society. It also has an effect on their self-esteem, though. The messages that they're given, they want to feel better, and they feel that if they feel better about themselves, if they look better, so to speak, then they'll be accepted more by others.
I see. Does it present itself differently for boys or girls? Will you see certain symptoms more in one than the other?
Yes. In girls and women, usually I see more restricting calories, binging, purging. And in boys or men, I usually see more increasing work.
I'm sorry, increasing what?
I'm sorry, increasing workouts or time at the gym. That they're trying to restrict their calories, but also trying to get those calories, especially if they've binged, out of their system.
I see.
That way.
What are some physical symptoms a person could experience with an eating disorder?
Well, there's a range of symptoms. As women, if we're talking about women, as women weigh less and less, you tend to see more amenorrhea, which is loss of their period, anemia, lack of iron, dry skin, hair loss, and now we're talking about men as well, anemia, dry skin, hair loss. Women and men feel cold. They don't have enough fat in their system. They've lost that. Their thought becomes slower. They don't have enough in their system to process as quickly as they used to. There's some heart rhythm problems that they could have leading up to heart attack, loss of bone tissue, which leads to osteoporosis, osteopenia.
So it sounds like there could be some pretty serious physical symptoms because of this.
Yes, absolutely. And if they don't, if people who have eating disorders don't address it fairly soon, it leads up to more and more severe things, which can lead to hospitalization and even death at some point.
Oh, okay. Explain to me a little bit about what the course of treatment looks like. Who may be involved in the therapy of somebody with an eating disorder?
Sure. There's normally a range of people that can be involved in treatment with them. Primary care doctor, therapist, outpatient therapist, dietitian, nutritionist to help explain what could help them maintain body weight, psychiatrist if they need a psychiatrist. Usually we like to start with the least restrictive environment as possible, so probably outpatient therapy. That's not working, going to intensive outpatient therapy and use of support groups, and if needed, then inpatient hospitalization.
I see. Are there any warning signs a parent may look for?
Yes, depending on the eating disorder. For some people who have problems with binge eating, they hoard food, and then eat it when they're on their own, not in front of other people. Women, girls, men who are restricting their caloric intake will be very picky about things that they're eating, not eat dinner with the family, and not want to eat in front of other people either. They don't want to eat a lot, and if they do eat, they will eat very low-calorie items. And again, a lot of these, if we're talking about teenagers or even men and women, have problems usually with body image too and self-esteem. So parents can be on the lookout for other issues that they see revolving around self-esteem.
What would a parent's role be in treatment? What would their involvement be?
Well, they can look for the symptoms that they described in terms of self-esteem, body image, use food. And if they see any of those symptoms, obviously try to involve a professional as soon as possible. Once somebody is involved in treatment, they can be involved with the therapist or the doctors to talk about what messages are appropriate to give their child or teenager, what messages they should withhold and not give so that they don't prolong any bad feelings of self-esteem, so that they don't prolong any anorexia or bulimia.
Now, I've heard discussion about a food plan. What exactly is a food plan?
Food plan would be something that a dietitian or nutritionist could talk about with the patient, or the person with the eating disorder, and if you're talking about a teenager, also with the parent. Depending on how severe the eating disorder is, you want to think about getting the person the right amount of nutrients that they need in order to stop any of the more severe things that we talked about later that would even lead up to hospitalization from occurring. So we want to get the person the right nutrients, and leading up to as the co-occurring therapies are happening, when they feel better about themselves, they can start to do some of that on their own.
Would a food plan involve both the monitoring or commitment to not only the quality of food, but the quantity of food as well, or is it just one or the other?
It could be both. It could be if they're in the amount we're wanting to get them the appropriate amount of nutrients, but leading up to the point where they can do a lot of that on their own. So we don't want to monitor to the point where we're totally controlling it. We want to encourage the person with the eating disorder to start monitoring it on their own, so they feel they have some more control there.
I see. And what kind of recourse would one have if somebody with an eating disorder is not following recommendations?
Well, we want to have them in the least restrictive environment as possible. So if we want to encourage them to go to outpatient therapy, to see their doctor, see a nutritionist. If they're refusing that, we want to educate them on the possibilities that could happen down the road. If they're refusing that and they know, they're aware of what could happen down the road, it would lead possibly to intensive outpatient programs, and then hospitalization if they need that.
I see. Do you recommend any kind of aftercare support groups for individuals with eating disorders?
Absolutely. There are usually support groups for different types of eating disorders, specific to that eating disorder, mostly through the hospital where there are specific programs for them. A lot of times I think if people with the eating disorders are hearing from other people who also have those same eating disorders, they are more likely to take that in, and also they can talk about their experience and relate with that other person. I think outpatient therapy and psychiatric help can also assist with them as well.
I see. Jean, you shared a lot of information with us. Would there be additional information you think would be helpful for our audience to know about?
Sure. I think something else to keep in mind that a lot of people who have eating disorders may also have co-occurring diagnoses, depression, anxiety, other things going on with them, sometimes related to self-esteem and how they feel about themselves. So that's something to keep in mind when you're looking at symptoms and when you're talking with a therapist, psychiatrist.
Great. Jean, I appreciate your time. Now, how could people contact you if they have further questions or actually want to seek out services for eating disorder?
Well, I'm located in the Gurnee area, and if people wanted to contact me, they can contact me either by telephone or email. My telephone number is area code 847-213-9909, and email is Jean K. Vargas, that's JeanKvargas @comcast.net.
Excellent. And as usual with these podcasts, I post contact information for the people that I interviewed on my website. Jean, I want to thank you very much for your participation in this. And you were very helpful, and it was great information. Thanks.
You're welcome.